Joined now by Dr. Todd Ellerin, Director of Infectious Diseases at South Shore Health. And I'm glad you're joining us because we did this story yesterday and I thought, I wish Dr. Ellerin was here so we could ask him this question. And here you are. So let's ask you this question. The CDC came out with this new information. They changed the definition of close contact for COVID-19. Now they're saying you can be infected during brief contact, even if you're 6 feet apart. And then there's a time change with all of this, with a 24-hour. It really does get confusing. So a lot of times we say, okay, this is what the rules are, and now they're all changing again. So take us through it.
All right, let me set this up for you, Maria. So in Vermont, in a prison, there was a prison officer who was infected with COVID-19. He infected a handful of other prisoners. So when they did video surveillance and looked closely, they saw that he hadn't spent more than 15 minutes or was within 6 feet of any of those prisoners, but he had spent less time with all of them. So what the CDC said is we should change our guidance to 15 minutes or more within 6 feet, but cumulatively within a 24-hour period. Mm-hmm. So if I'm with you for 5 minutes within 6 feet, 3 different times during a day, you would classify me as a close contact, if that makes sense.
Okay, yeah, it does.
It does make the contact tracing much more complex.
Yeah, right. Yeah. All right, so let's talk about the future and the vaccines and therapies. Moderna now says it's enrolled all 30,000 participants in its phase 3 vaccine trial, but there is another vaccine complication, growing concerns over dry ice and methods to keep those vaccines cold. And when I say cold, I mean like ridiculously cold. Can you explain that so we can understand why that's an issue?
Absolutely, Eddie. So I think the key is these messenger RNA vaccines, which both Pfizer and Moderna have, are cold sensitive. They need to be kept under cold conditions in order for them to work effectively. So Moderna's is about what our home freezer would be. That's minus 4 degrees Fahrenheit. With Pfizer's right now, the reports are that it has to be kept at minus 103 degrees Fahrenheit. That's about 4 times colder than our freezer. So it means that the delivery of these vaccines to offices, pharmacies, hospitals, it's going to need very sensitive temperature control. Now, hopefully over time, these companies will test the vaccines under warmer temperatures. That sometimes happens. But at least in the beginning, this is going to be a complex distribution.
Understand. Very good.
All right. Can we talk about this quick myth and this question on social media? A lot of people are saying, and I've actually heard this for a long time, claiming mouthwash can essentially kill COVID-19. True or false?
That's false. So mouthwash has been tested against one of the common coronaviruses, not the one that causes the common cold. And it was shown to inactivate it in the lab. None of this has been shown to be effective in humans with the common coronavirus or COVID-19. I'm not saying don't use mouthwash, but don't assume that mouthwash is going to kill COVID-19.
Dr. Ellerin, I'm going to ask you this question, and I understand fully, maybe you haven't a chance to look at all the latest information. We just reported in the 4 o'clock news, breaking news about the coronavirus battle. The FDA granting approval for an antiviral drug as a treatment for hospitalized patients. We're talking about remdesivir. Is this a major breakthrough? Is this a big step?
Well, we've known that remdesivir it's actually considered a standard of care in the United States for patients with COVID-19 who are hospitalized. We know it reduces the viral load, the COVID amount of virus, and in one study at least, at the NIH study, it improved recovery times. Now, there is controversy because many other studies has not shown that same endpoint. So I think it still remains controversial, but it is a standard of care right now in the United States.
Got it, Doc. Thank you so much.
Thank you, Doctor. Be well. We appreciate it.
You too.